I'm Dr. DeFabio with your training tip for triathletes. We have us today an Ironman triathlete who originally had back pain, and we were a little concerned on why he was having back pain with his training for an Ironman. Well, Sasha, show us what was happening with your quarter squat. When he did his quarter squat, we were noticing that the hip was dropping and the knee was going in a little bit. He wasn't being able to maintain level hips as he was squatting. That's good. His regular squat was great, but as soon as we single loaded him, the hip was dropping and the knee was rolling in. That became a problem because there was a lack of stability. But how did that happen? Well, run in place for me, please. Running, as you can see, is very linear. Everything goes forward. Let's pretend you're on the bike, okay? So when you're cycling, what happens? As you're cycling, the leg is, again, linear. It's always going forward. That's great. You're never using the side muscles. Turn this way. You're never using these muscles, which send your leg out to the side, which do that. You don't do that when you swim, when you bike, when you run. Very little. That's great. Thanks. So what happens is all the front muscles get really strong, but these muscles don't get strong enough to keep up. Why is that a problem? Because when the hips aren't strong and stable, you get that unleveling, and that's what was happening when he was running, and he didn't even know it, and that was causing irritation to his back. We could give him some standard glute med strengthening exercises, but it wasn't doing the trick. Why? Because he was training 20 to 24 hours a week for an Ironman. So what did we do? We did some glute med strapped monster walks. Great exercise. Make this part of your rehab. Sasha, stand on that for me. What we do is we take exercise tubing and you stand on it. You wrap them up. Hold that one. And you wrap it up over the feet. This is the #1 injury prevention strategy in the NBA for recurrent ankle sprains, by the way. And cross them in the front and then hand them to me over here. So this is how we strap you up for your glute medius monster walks. Great. Now, in this position, he's going to walk like Frankenstein. Go ahead, walk forward, pushing out, keeping the toes forward. He would do that for about a minute. Turn around, come back towards me. Then he'll walk for a minute with the toes out, engaging different muscles in the glutes. And just stop for 1 second. That's engaging all of the muscles right in through here. Your glute med primarily, but all of your external rotators. A minute straight ahead, a minute turned out. Then you can turn around and he'll do 1 minute with the toes pointed in, walking like that. You want to get a burn for your hips? This will give you a burn for your hips. Good. Turn around and come on back. So very simple, very slow, pushing out the whole time, yet also getting engagement of the glutes and the hips. You can turn around to the front. Strengthening your glute medius muscles are essential for runners, for cyclists, for everybody. I'm going to date myself. Anybody who remembers the actor Walter Brennan that had that hip dropping as he walked, he had glute medius weakness. If you need to really hammer your glute meds and strengthen them up, strapped in glute med walks with tubing is the way to go. I'm Dr. DeFabio.